Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cardiomyopathy. Introduction. Cardiomyopathy refers to diseases of the heart muscle. These diseases enlarge the heart muscle or make it thicker and more rigid than normal. In rare cases, scar tissue replaces the muscle tissue. Some people live long, healthy lives with cardiomyopathy. In others, however, it can cause serious complications. Treatment might involve medicines, surgery, other medical procedures, and lifestyle changes. This program explains cardiomyopathy, including the different types. It also covers symptoms, causes, diagnosis, and treatments. The heart. The heart is the most important muscle in the body. Its main function is to pump blood to the lungs and to the rest of the body. This section reviews basic information about the anatomy of the heart. The heart has two sides, the left side and the right side. Each side is divided into two sections. These sections are called chambers. The two chambers are called the atrium and the ventricle. The blood from the body comes through big veins into the right atrium of the heart. From the right atrium, the blood is pumped to the right ventricle. The blood is then pumped to the pulmonary artery and into the lungs. In the lungs, the blood gets loaded with oxygen and carbon dioxide is released. From the lungs, the oxygen-rich blood goes to the left atrium, then to the left ventricle. From the left ventricle, the blood is pumped to the rest of the body through the aorta. The aorta is the biggest blood vessel in the body. Since the heart is living tissue, it needs oxygen just like the rest of the body. Oxygen-rich blood is delivered to the heart through the coronary arteries. These arteries branch off from the aorta. Valves separate each atrium from its corresponding ventricle and the ventricles from the pulmonary artery and aorta. These valves allow the blood to only go in one direction. The heart contracts automatically in a very coordinated way. Special cells located in the atrium set off the electric current needed to cause the atrium to contract. The electric current spreads to the ventricles through specialized cells. This causes the ventricles to contract after the atria do. Types of cardiomyopathy. Cardiomyopathy, or diseases of the heart, can enlarge your heart muscle or make it thicker and more rigid than normal. In rare cases, scar tissue replaces the muscle tissue. The main types of cardiomyopathy are dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy, arrhythmogenic right ventricular dysplasia. This section briefly explains these types of cardiomyopathy. Dilated cardiomyopathy is the most common type of cardiomyopathy. It affects the ventricles and atria. The disease often starts in the left ventricle, which is the heart's main pumping chamber. The heart muscle begins to stretch and become thinner. This causes the inside of the chamber to get bigger and usually spreads to the right ventricle and atria. Dilated cardiomyopathy affects how well the heart pumps blood. Over time, it can lead to heart valve problems, irregular heartbeats, heart failure, and blood clots inside the heart that can travel to the brain and cause strokes. Hypertrophic cardiomyopathy, or HCM, happens when the heart muscle cells enlarge and cause the walls of the ventricles to thicken. The thickening may block blood flow in the heart. HCM can cause heart valve problems, irregular heartbeats, and high blood pressure. Restrictive cardiomyopathy happens when the ventricles become stiff and rigid because of abnormal tissue. The ventricles cannot relax normally and refill with blood. Over time, the atria get bigger. Blood flow in the heart is reduced. This can lead to problems such as heart failure or an irregular heartbeat. Arrhythmogenic right ventricular dysplasia, or ARVD, is a rare type of cardiomyopathy. ARVD happens if the muscle tissue of the right ventricle dies and is replaced with scar tissue. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Some people live long, healthy lives with cardiomyopathy and never have signs or symptoms. Others develop signs as the disease gets worse. Cardiomyopathy can often worsen, causing the heart to become weaker. This may lead to heart failure. Signs and symptoms of heart failure usually appear at this stage. The signs and symptoms of heart failure include extreme tiredness, shortness of breath or trouble breathing, especially while being physically active, swelling in the ankles, feet, legs, abdomen, and veins in the neck. Other symptoms include chest pain, especially after exercise or heavy meals, dizziness, lightheadedness, or fainting during physical activity, heart murmurs, irregular heartbeats. These symptoms may or may not be caused by cardiomyopathy. Make sure to see your healthcare provider to find out what is causing your symptoms. Causes. Diseases that may cause cardiomyopathy include diabetes, diseases that affect the heart such as coronary artery disease, high blood pressure, human immunodeficiency virus or HIV, thyroid disease, viral hepatitis. Other causes of cardiomyopathy are alcohol, especially with a poor diet, certain toxins such as cobalt, certain illicit drugs such as cocaine and amphetamines, infections, especially viral infections that inflame the heart muscle, some cancer treatments including radiation and chemotherapy. Many times the cause of cardiomyopathy is unknown. This is often the case when the disease happens in children. Cardiomyopathy can be inherited or acquired. Inherited means your parents pass the gene for the disease on to you. It can also be acquired. Acquired means that you aren't born with the disease. Instead, you develop the disease due to another disease, condition, or factor. Diagnosis. Often, cardiomyopathy is diagnosed by a cardiologist. A cardiologist specializes in diagnosing and treating heart diseases. You will first be asked about your family's medical history in addition to your own. A physical exam will also be performed. During the physical exam, your healthcare provider will listen to your heart and lungs for sounds that may suggest cardiomyopathy. Physical signs, such as swelling of the ankles or abdomen, are also signs of heart disease that may be found during a physical exam. Tests and procedures are also used to diagnose cardiomyopathy. A BNP blood test checks the level of a hormone called BNP, which rises during heart failure. A chest X-ray can show whether your heart is enlarged. It can also show whether fluid is building up in your lungs, which is a sign of heart failure. An electrocardiogram, also known as an EKG, may be used to check how fast the heart is beating and its rhythm. This test takes only a few minutes. During this test, electrodes are placed on the chest and body to record the heart's electrical impulses. Some heart rhythm problems come and go and may not happen during an EKG. In these cases, you may be asked to wear a portable EKG. One portable EKG test, known as a Holter monitor, lasts for 24 or 48 hours. Another type, called an event monitor, only records abnormal heart rhythms. Another test that may be done is called echocardiography, or an echo. This test uses sound waves to create a moving picture of your heart. The picture shows how well your heart is working and its size and shape. One type of echo is a transesophageal echo, or T. T uses a sound wave wand and a special tube. The tube is placed down the throat and into the esophagus. This provides a view of the back of the heart. Some heart problems are easier to diagnose when your heart is working hard and beating fast. During stress testing, you exercise to make your heart work hard and beat fast while heart tests are done. If you are unable to exercise, you may be given medicine instead. Sometimes one or more medical procedures are needed to look at the heart and arteries and take samples to confirm a diagnosis of cardiomyopathy. Some types of cardiomyopathy run in families. Genetic testing can be useful if your doctor thinks you have cardiomyopathy but you don't yet have the symptoms. It can also be used to check your family members for the disease if you are diagnosed with cardiomyopathy. Treatment. For some people with cardiomyopathy, treatment may not be needed. People without symptoms may not require treatment. Sometimes dilated cardiomyopathy that comes on suddenly may even go away on its own. For other people with cardiomyopathy, treatment is needed. Treatment depends on the type of cardiomyopathy, how severe your symptoms are, your age and health. Treatment for cardiomyopathy may include lifestyle changes, medicines, or a procedure. Lifestyle changes can help manage a condition that is causing cardiomyopathy. They can also reduce symptoms. They include healthy diet, weight management, stress reduction, and other changes. A healthy diet and physical activity are part of a healthy lifestyle. Talk to your healthcare provider or a dietitian for help in planning a well-balanced diet. Some people with cardiomyopathy should also get medical advice before starting an exercise plan. Other lifestyle changes that can help people with cardiomyopathy include avoiding the use of alcohol and illicit drugs, getting enough sleep, losing excess weight, quitting smoking if you smoke, reducing stress, treating underlying conditions such as diabetes or high blood pressure. Medications may be prescribed to treat cardiomyopathy. Ablation is a procedure that uses energy or chemicals to damage parts of the heart that aren't working right. A healthcare provider will send the energy or chemicals through a narrow tube in a blood vessel that goes to the heart. This treatment option is less involved than surgery and has a faster recovery. Cardiomyopathy may also be treated with different types of surgery, including septal myectomy, implanted devices, heart transplant. During a septal myectomy, part of the thickened septum is removed. The septum is the part of the heart that separates the right and the left ventricles. This improves blood flow in the heart. If needed, the mitral valve can also be repaired at the same time. Surgically implanted devices can help the heart work better. One example is a pacemaker. This small device is placed under the skin and its electrical wires are threaded to the heart muscle. It helps control an irregular heartbeat by sending electrical pulses to help the heart beat normally. Sometimes a ventricular asset device, or a VAD, is placed in the body. A VAD is a machine that helps the heart pump blood. It may be used in people who are waiting for a heart transplant. In heart transplant surgery, the diseased heart is replaced with a healthy heart from a donor. A heart transplant is the last available treatment option for people with heart failure who cannot be treated any other way. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Cardiomyopathy refers to diseases of the heart muscle. These diseases enlarge the heart muscle or make it thicker and more rigid than normal. In rare cases, scar tissue replaces the muscle tissue. Cardiomyopathy can often worsen, causing the heart to become weaker. This may lead to heart failure. Signs and symptoms of heart failure usually appear at this stage. The signs and symptoms of heart failure include extreme tiredness, shortness of breath or trouble breathing, especially while being physically active, swelling in the ankles, feet, legs, abdomen, and veins in the neck. Treatment might involve lifestyle changes, medicines, surgery, and other medical procedures. Treatment depends on the type of cardiomyopathy, how severe your symptoms are, your age and health. Some people live long, healthy lives with cardiomyopathy. In others, however, it can cause serious complications. Your healthcare provider can help you find a treatment plan that works for you. Thank you for using Explain.